So an initial client consultation would involve what we call a subjective assessment, where we go through the history taking of that person's main problem area. So we would ask a few questions about what the issue is, specific questions about the pain area, the type of pain, and what it means to them. So things like aggravating factors, how it's affecting their hobbies, how it's affecting their quality of life. And that would also include past medical history and sort of any issues or previous injuries from the past. We would then go into what we call the objective assessment, which is where we would have a look at that person's function specifically to that area. So for example, if it's the knee joint, we would look at range of movement of the knee, looking at your flexion and extension, looking at some strength testing of the muscles around that joint. We would also then look at other areas, again, depending on the history and what we're seeing from that initial assessment, looking at some more functional movement patterns, again, things like squats, split squats, and then we would come up with a plan as to how to manage those symptoms depending on what we'd found in the assessment. So for example, if it was the knee joint we were looking at and if there was a weakness in the muscles around the hip, we would then devise a strengthening program for the muscles around the hip.